about 2 years ago, started out that I thought I had an allergy. I was getting a scratchiness in my throat. So my wife, Maureen, decided to take me to an allergist. So we went to an allergist, and all along Maureen kept saying, I don't think it's an allergy. There's something else wrong. Well, I was a smoker. So one afternoon, I was out there having a cigarette, and I managed to cough up a little blood. That was it. She said, we're taking you in. They put me through a battery of tests, everything from a complete physical to MRIs, CAT scans, PET scans. They have a team of doctors, tumor board, if you will, that looks at the various tests. And then they introduced me to the surgeon, Dr. Holsinger, wonderful man, and the other physicians that are going to take care of me. They told me what was going to happen, and they walked me through the various steps. And from the time they diagnosed it to the actual surgery, it went fast. It went very fast. And away we went. We went to surgery. Mm-hmm. And then, like 12, 13 hours later, I woke up and I had this hole in my neck, for lack of better words. And my new life started to begin. You know, I gotta tell you, I went in there, I got the surgery, I came out with the trach. I didn't notice the difference at all. I was breathing just as normal as I would before. No special training, nothing like that. Just, getting used to it. I couldn't speak at all. I had the feeding tube in there because once they removed the larynx, now they've got a tube between your tracheotomy, your trach, and your esophagus. The larynx is gone, so that's the only way they could do it, to feed you. You couldn't take in sustenance through your mouth. At that point, you gotta heal.
He was in the hospital for 9 days, and actually I was checking him out of the hospital, and Dr. Starmer called and said, would you bring him over to the office? And we walked in there, and she said to him, you're going to speak today. And I looked at her, I said, pardon me? Because he hadn't spoken in 9 days, and she said, no, he is going to speak today. And she put the prosthetic voice box, and she put it in, and he went to speak the first time, and really partly nothing came out. And then, he covered the stoma again, and he took a breath, he covered the stoma, and he said 1, 2, 3, 4, 5, 6, and he just counted it out. And it was very emotional, because I didn't know if he'd ever be able to speak again. They told him he would, but you just never know.
I started chemo, I want to say August. Surgery was in June, about August. Mm-hmm. And I didn't think anything of the chemo. I had the first loading of the chemo that lasted, 6, 7 hours. Real big dose. And I kept saying, what's the big deal? Until 12 hours later. And then it hit me. I got a little sick. And I went into the hospital. I was there for about 10 hours or so. They let me go. I was okay. The chemo was once a week for 8 weeks. And basically, anybody who's taking it goes in a chair. They shoot you up, my chemo, and I watched TV. I fell asleep, and that was about it. I never got sick from it after the first dose.
And then how soon after the chemo did you shift to radiation?
After the second week of chemo, and And the radiation treatment itself only lasted about 5 minutes. That was it. However, getting you in position and lined up, that could take an hour to get you just right. But the treatment itself, 5 minutes. And you don't feel anything. They're shooting this stuff into you. You don't feel it. They started telling me how terrible this was going to be. And after 2 weeks, I said, this is nothing. Well, then, the other shoe fell. The radiation kicked in. And then that was painful. That was the only pain I ever had. It's the radiation. The best way they described it is like a deep sunburn. And it was right in my throat. And I couldn't swallow anything. And that lasted about 3 weeks. And during that time, your taste buds are shot. You can't taste anything. But eventually, it goes away. And your taste buds return. And you start enjoying the food again. You know, in light of everything, when you find out that you're diagnosed with it, cancer, after you get over the initial shock, I realized, I said, you know, it's not a death sentence. You're not necessarily going to die from this. We're going to deal with it, and we're going to go on with our life. And that's what we've been doing. We've been getting on with our life. And life is good, I can tell you. It is good.